During Heart Health Month in February, we want you to get pumped about your heart. We want to give you information to help reduce your risks. So we have a list of 10 different things that you can do to help decrease your risk for heart disease or heart health issues. One, simply work with your healthcare professional. Talk with your doctor or healthcare provider. Maybe you need to get tested for certain things. Maybe you need to go on medication because your blood pressure or cholesterol are a little bit too high. If you are smoking, we recommend that you stop because smoking is one of the most preventable risk factors for heart disease. It's hard to change your family history. You can't change your age, you can't change your gender, but you can change whether you're a smoker or not. So you can also get information about how to quit smoking from the North Carolina Quit Line. And again, I mentioned controlling your blood pressure and your cholesterol. This is something that you need to talk with your doctor about, but you can also control these things by improving your diet, by eating things that have less sodium or less fat in it. And the Extension Office can help provide information for you on how to be healthy for your heart. In our Lunch and Learn that we're going to have virtually on Tuesday, February 9th, we're going to provide information about heart disease, about heart health, specifically for women, as well as things that you can do to improve the health of your heart. You can also maintain a healthy weight. That's going to be one of the things that we talk about. Even just losing 5 to 7% of your weight can make a drastic improvement in your risk for diabetes and heart disease. And we can give you more tips on how to do that. One of them is just going to be to tell you to be physically active. Adults are supposed to get 30 minutes of physical activity every day, 5 days a week. The kids need 60 minutes. So if you have children or grandchildren, go and exercise with them. Go play outside with them and just enjoy being physically active with your children or grandchildren because they need to burn off more of that energy than even you do. And again, eating heart smart. We're going to give you information about what that means, but just reducing the amount of fat in your diet, or specifically reducing the amount of saturated fat, using more heart healthy oils such as olive oil, eating more whole grains to increase the fiber in your diet, eating more fruits and vegetables. All of these things are important, not only for your weight, but also just for your heart. If you are at risk for diabetes or you're already suffering from diabetes, you can reach out again to the Extension Office about one of our programs that we're offering about how to prevent diabetes or how to better manage it if you've already been diagnosed. And one of the other factors that often people forget about is just getting enough sleep. Adults are supposed to get about 6 to 8 hours of sleep a night, but most of us do not. So there are things that you can do to try to make sure that you have an optimum sleep environment, even if it's just not watching, a lot of crazy TV or playing on your phones or your tablets like right before bed, because that stimulates your brain and it's often hard to go to sleep afterwards. And again, just talking to your doctor, talking to your therapist about making sure that you are on the right medication for you. Women have a higher risk for heart disease. In fact, heart disease is the #1 killer of women. And oftentimes this can be related to different hormones or things that are going on in your body that have nothing to do with, per se, your health. So if you're having issues with your thyroid or your hormones, talking to your doctor about that can be very important. So these are just 10 quick tips to help you reduce your risk for heart disease during the month of February, which is American Heart Health Month. If you want information about any of our programs, you can contact the Extension Office. Check us out on Facebook at Person Granville FCS, or again, go to the American Heart Association website at heart.org. This is your food for thought.